Okay guys, this is Dr. An, and I know that I have to make a video when I keep having to have the same educational conversation with the patients. So as you know, at the Campbell Health Center, we take care of a lot of patients who have type 2 diabetes and nerve damage symptoms, or patients who have knee pain, hip pain, and lower back pain. And considering that these joints are weight-bearing joints, it's really beneficial for patients to lose some load off these joints. On average, last time I looked at, average of our patients were 67 years old and had about 36 to 38 pounds to lose, okay? So that's a lot of weight, and losing weight will absolutely help improve the losing excessive weight will absolutely help improve the nerve damage symptoms. And if you're doing regenerative medicine or entered into a stem cell therapy with a rehab for these joint conditions, in order to make the most out of the program, it is best to lose even just 5-10 pounds and take some load off those joints. Okay, so I have put together this video as an action guide on how to start doing that. Okay, so what this video is for, okay, because not everybody has that extra weight to lose, right? So if you have entered into a program at Campbell Health Center for neuropathy, joint pain, especially knee, back, and hip, or you have started our weight loss program using semaglutide, and or you just never been able to lose the weight and keep it off, then this is where you start. This is not for you if you have normal BMI, obviously, or you just have a problem area, you don't have any weight to lose, or if you want to lose weight quickly, this is not lose weight quickly guide. Because you know what happens when you lose weight quickly? You're going to gain it back. You know the popular television series Biggest Loser? Why there is virtually no reunion of the past winners? Because almost everyone gains that weight back. So I want you to lose weight slowly, okay? And this is how you start doing that. This is not also an educational or understanding video of how hormones work, what fat switch is, the benefits of an intermittent fasting. This is not explanation video. This is a action guide on how to do it. So this is for you if you need to lose weight and keep it off, and you don't mind doing it slowly. You also don't want to read the 7, 8, 9, 10 books on how to do it, because I've done it for you. So you don't have to spend all this time reading all this book. You also don't want to spend hours watching online videos on how to lose weight and why intermittent fasting is beneficial for you, how hormones work, etc. Because again, I have done all the research for you, okay? So let's be honest here. If you want to lose weight and if you want to get information on how to do it, there is a plethora of information on the internet how to do it. So I have done all the reading for you. I have done all the research for you. And I have compressed it into a very short video for you to start doing it. Okay? Because you have to start somewhere, right? And starting is probably the most difficult thing to do, okay? And requires you the most amount of momentum to get going. So think of this as a step 1 of the video, how to start to improve type 2 diabetes, how to improve insulin resistance, how to lose belly fat, how to improve your neuropathy symptoms, or how to make the semaglutide and other weight loss program work better. So it was difficult for me to do. I had to think about it for a while, but what I'm about to share you is how I lost 25 pounds that I was never able to lose over 2-year period. So I have taken a picture of myself in underwear, but nothing gives you confidence and makes you feel good seeing the progress of your work. So again, I did not do this in 8 weeks or 12 weeks. It took me 2 years to do it. But here I am. I was able to lose almost 3 inches around my waist. I am a 5'1" and a small person, and people always ask me, where do you have to lose? Well, right here. It was all right here. Okay? So I was able to lose 3 inches and all of that, right? Using the method that I'm about to share with you. So this is how to do it without buying any expensive supplements or equipment, but it is going to be worth it for you to invest in a good digital scale that syncs with your iPhone. I can post a link somewhere or link on the bottom of the YouTube channel. I bought a like $22 Bluetooth scale from Amazon, and it just, again, nothing gives you confidence than seeing a progress of your effort. Okay, so again, this is done over literally like a little over 2.5-year period. So I'm about to show you how I did it and how I'm keeping it off. Let's do this. Okay. So number 1, ask yourself, how many meals a day am I eating? So there's breakfast, lunch, and dinner. And I'm finding that a lot of people who are diabetic really are not eating that many meals a day. Some people will tell me that I'm eating 1 or 2. Rarely, they'll tell me they eat 3 meals a day. Okay? So ask yourself, how many meals a day am I eating? If you're eating only 2 meals a day, let's just say that you're only eating lunch and dinner. Then, I'm just giving you an example, okay? You want to continue on eating these 2 meals a day for a good 3, 4, 5 weeks time, okay? So what are you changing here? You're not changing anything, right? Except you're committing yourself to eat just 2 meals a day at a set time of the day. So lunch at 12, giving you an example, dinner at 7 p.m. So let's say that is the case. Then you're going to stick to eating just 2 meals a day at a set time. Now here is what you're going to start doing. No snacking in between. No snacking in between. Okay? So you're just going to eat 2 meals a day. Do not eat cookies, chips, whatever that you've been snacking on. You're not going to snack. You're going to stop. You're just going to stick to your 2 meals a day. And I'm also finding that a lot of these patients who says that I'm eating 1 or 2 meals a day are also snacking in between the meals. Okay? So what happens is every time you eat, your body is going to produce insulin. This is how you develop insulin resistance. Before you became diabetic or before you became type 2 diabetic, okay? So by not snacking, we're going to be reducing the amount of insulin in the body, all right? And it's kind of weird because if you are type 2 diabetic, diabetes is a disease of too much sugar in your blood, right? And yet, few doctors or nobody tells you not to eat sugar, right? Diabetes is also a disease of too much insulin, all right? So injecting yourself with more insulin is not the thing to do or way to treat diabetes, okay? So you're going to do this for about 4 weeks. For the first 4 weeks, you're just going to stick to the normal way of eating 2 meals a day, or if you have been eating 3 meals a day, you will stick to eating the 3 meals a day at a set time, but in between, you're not gonna snack, okay? Now, I'm also finding that a lot of people are snacking by eating fruit. Okay? Now, I have a bad news for you. If you have weight to lose or reasons to lose some weight, or if you're diabetic, fruit's gotta go. Fruit's gotta go. And I don't mean only eat 1-2 servings a week. And I mean, for the time being, get rid of fruit from your diet. Okay? Do you know, in the wild, if an animal or bird has to go through a period of famine or a long travel, like migrating birds, or they have hibernation coming, like some bears hibernate during the winter time, in preparation, what do? They eat a whole lot of fruit and fatten up by making themselves insulin resistant. Okay? So, the fructose sugar in fruit will make you gain weight and become insulin resistant very, very quickly. So, if you're eating fruits or snacking fruit's gotta go. All I'm asking you is stick to your meals and don't eat fruit. Do this for about 4 weeks. Give your stomach a little bit of a chance to shrink a little bit and improve your insulin sensitivity a little bit. Okay? So let's do this here. What are you working towards? I'm drawing a clock. Okay? Let's say that you're eating lunch at 12 and dinner at 7. What you're going to work on is reducing the time in between you eat. So this is how you start with intermittent fasting, okay? So after 4 weeks later, maybe you'll push back your lunch to 1 p.m., but you still have your dinner at 7 p.m. See how now that eating window is a little smaller, right? And you're still not gonna snack between the meals right here. No snack. No snacking. Okay? Moving on to the next page. So let's say that you did this for another 4 weeks. Starting on week 9. Now you may push back the lunchtime to 2 p.m. But you still have your dinner at 7 p.m. Now that window is just a little smaller. During this time, your insulin, your leptin sensitivity will improve, right? And you will be less hungry. But if you have trouble controlling your appetite, then we have pharmaceutical and supplement that can help you curb your appetite as well. Again, just a reminder, no snacking during this time, and no fruit. And you'll do that for 12 weeks. Okay? I told you, you're doing this very slowly. Okay? You want to gradually decrease that time down to 5, 6, 7, 8 hours. So the only hours that you eat, you have a window of hours that you eat, and that's going to be 5, 6, 7, 8 hours. And you're going to make that window very set, working towards it over the next 12 weeks. So think of it, like I said, think of this as a video number 1, right? I'm not even going to discuss what you should be eating during the time or during the eating window, but this is a good place for you to start. Okay? Going back to the snacking, don't try to use your willpower not to snack. Okay? Use a system, and that is a system of not having snacks around your house. So it's gonna be better not to have the temptation versus trying to fight the temptation. Okay? So if you can do this over the next 10-12 weeks, and if you are diabetic and you've been consuming fruit, just by not consuming the fruit, your blood glucose numbers will come down significantly. And I hear this a lot in my office from patients that's been consuming fruits, thinking that it is good for them. Banana has potassium, my body needs potassium, right? Oranges have vitamin C. I'm going to tell you to stop snacking on fruit or get rid of fruit from your diet until we can get your body to normalize, okay? A few other things that I want to add in this video is you have to do everything you can to get good nights of sleep. You do know that sleep is a foundation of health and mental health, okay? You also want to hydrate yourself with water as well, because dehydration is one of those things that switches on your fat switch. Okay, so I hope this video was helpful for you to get started somewhere in taking better control of your health. And as I mentioned earlier, if you have been entered into our Join Regenerative Medicine program, or you're doing our neuropathy program, this is going to help you supercharge the results that you're going to be getting from our program. I will be posting the digital scale that I personally use and the link to it, Amazon link to where you can purchase it. And wait for part 2 video where I will talk about foods that you should be eating and you should not be eating.